Hi, I'm Dr. Andy Evans in sunny San Diego, California at the 66th annual ASH Hematology meeting, and I'm really happy to be here with Dr. Peter Cole, Chief of our Pediatric Oncology program, which really is a network of a program, academic medical center in New Brunswick, but with other satellite centers and other hospitals in Newark, Beth Israel, and Long Branch. Peter, great to see you.
Same here. Good to be here.
And I know you have a busy meeting involved with a couple different presentations. Let's first start with your and our involvement with the Dana-Farber Cancer Consortium. Tell us a little bit about that, and maybe one of the really important presentations here when you're looking at different risk groups based on age.
Sure. So the Dana-Farber Acute Lymphoblastic Leukemia Consortium is a group that I've been involved with for almost 20 years now. A lot of my translational research drives what we're doing in our clinical trials as well. What we're reporting today at this meeting is the results from our most recent clinical trial, which opened in 2016, looking at ways to reduce toxicity for children being treated for acute lymphoblastic leukemia. For a couple of decades, we and others in the country have been using a cutoff of age 10 to define kids who are at higher risk of relapse who need more intense chemotherapy. In this clinical trial, we piloted using a higher age cutoff, up to age 15, who are now being treated with less intensive chemotherapy, experiencing less in the way of both short-term and long-term side effects from treatment. And we're reporting on the safety of that approach today.
Yeah, it's so important. We know our pediatric oncology experts like Dr. Cole have just led the world in terms of excellent outcomes, which is great, but we want to keep those outcomes with minimal acute, post-acute late effects. So that's really great. Let's pivot a little bit now to Hodgkin lymphoma. I know that's a specialty that you have as well, and another consortium or cooperative group that we participate in is ECOG,
right.
And we were part of a randomized clinical trial looking at a doublet or triplet of immunotherapy with an antibody-drug conjugate. Tell us about that.
Sure, this is a very exciting trial looking at ways of treating adolescents and older adults with relapsed Hodgkin lymphoma, taking the approach of not using conventional chemotherapy, using an immunotherapeutic approach only, and comparing two different treatment options, one using brentuximab, an antibody-drug conjugate, with nivolumab, a checkpoint inhibitor, and comparing that with a triplet, adding in ipilimumab, another immunomodulating agent. What was exciting for me was being able to include pediatric patients in this international clinical trial. We had 14, which sounds like a small number, 14 pediatric patients who were enrolled on this trial. 100% of them had a complete response, regardless of the treatment arm they were on. Very manageable toxicity. Many of them ended up being cured without needing to go on to autologous stem cell transplantation. So this is a very exciting outcome.
They really are. It's exciting times, and we're happy Dr. Cole and his colleagues are able to really have these novel cutting-edge clinical trials available to our patients, not just in New Brunswick, but throughout the state of New Jersey. Peter, have a great meeting.
Thank you. You too.
All right.
Good talking to you.